Okay. And then I will start sharing my screen again. Let's see. And then there we go. Okay. But all right. Is do you also, since it's clinic, is it also like a lunch break between 12 to 1?
Yep, typically, when all goes well, this week, tomorrow I have a sales rep that they have a new product. And I actually said, why don't you come and have lunch with me? Because you fly in from Florida. So we were supposed to have a lunch meeting and a review of her new vitamin product tomorrow.
Mm-hmm.
But then they slipped me a patient at lunch, which that's the one thing you don't always have control. In a
Yeah.
hospital setting, you do, but in a clinic setting, your schedule is created for you. So I'm going to message her a little bit later and say, come on by and show me your product, but I don't have the luxury of eating with you. But that's not very often, you know.
Right.
Usually it's just if there's an extenuating circumstance. Yeah.
Right. Oh man. I feel like it's more busier when because I have the great opportunity working in clinic and inpatient with wound care, and so I feel like with clinic it's just so busy. Like
It is.
it's
And I feel bad for the dietitian that started, came from a WIC setting,
hmm
and it's very different WIC from inpatient. It's very different. It's it's sort of not as clinically like an ICU, CCU wound care. It's
right.
not as clinical. So there's a big learning curve here for us. She'll be fine, you know.
Yes. Sure she'll do
Over time,
well.
over time you adapt. So
Well, okay, so I have some of our members on. We can start now. Well, thank you everyone for joining. I know this was a bit impromptu, but I'm just really happy to have Ms. Andry here. Been trying to get her on, and would love to have you guys hear her story and her role as a clinical dietitian. So, just a brief little news. This month is National Nutrition Month, and I'll be sending out more information on events and speakers we'll have throughout this month. So, look out for the email for that. But without further ado, I have Miss Andrews who will talk about her experience and her role as a dietitian at Piedmont Atlanta. So, whenever you're ready.
yeah, so I didn't prepare much of anything. I'm sorry I couldn't send you a headshot, but the
Oh,
one
it's
you have is
fine.
my least favorite headshot
Oh.
that's taken. But no, I kind of thought of this morning what my two maybe wisdom words would be for a young group of students. My daughter's actually right now at Emory working on her PhD in virology. We're all a pretty big clinical family. My big brother's a pathologist. He consults for CDC and he works at Children's. Um, so my sister's a speech pathologist. But what I would say, words of wisdom to a young, fresh out of school or just a couple of years is, continue for us. I feel like we are sort of an unknown entity, an ancillary group that not a lot of people know what we do. Not a lot of people realize that clinical is not just um, cooking, because it's not what we do at all. Well, I had the pleasure, really fresh out of school, of doing a radio show. I don't know how we got connected through it, but I worked for a community hospital for about a year. And so I'm on this radio show, and the man actually asked me, so how much experience or how many cooking classes did I actually have to take? And I was so appalled I couldn't even think of an answer. Like, what would you do if you were asked that, right? I said, there's nothing in my background that is cooking. I don't even know how to cook. All we do is clinical and, the pathology of the body, et cetera, et cetera. But so the one wisdom I would give everyone is continue to toot your horn, continue to say clinical. When I chart, I write medical nutritional therapy. I never write, just a nutrition note, because we need to remain experts or to be thought of as experts in the field of nutrition. And it's a very difficult road. It wasn't easy for you to get where you are, right? I don't have the luxury of a master's or a bachelor. A bachelor's is what I have, a master's or a PhD in nutrition, which a lot of my friends do have. Um, I do have certification in diabetes ed, so I really like that. So let me go back to the second wisdom. I feel like I always want to learn. I feel like growth is always paramount. I'm always wanting to learn. What is the science of nutrition is always changing, right? I feel like we're always needing to learn and grow. And when we stop is when we become stagnant in our field, first of all. Um, so how I began, I started after Florida State, 4 years at Florida State. I went to an internship in Augusta, Georgia, and my first job was the only dietitian in a small hospital. It was fine, but I wanted kind of more growth. So I moved from there to a big teaching hospital, and there I was a clinical manager. So I had the train line in the diet office and management. I really didn't like it. I was fine at it, but I liked clinical, strictly clinical. So I kept my feet in the pool. I did some floor work, and I filled in for the dietitians on vacation, which kept me really abreast of things like an ICU and a CCU. I also had the second clinical job was a bigger location, management wise, and a little bit more responsibility. But we also had a burn unit there, and we had the CCU, ICU, step down like cardiac. So I got kind of grew clinically, learning about burn patients and, educating myself, trial and error about calorie needs and protein needs. Um, from there, where did I go? So I was in St. Simon's Island, and then I went to New Orleans, and that's when I had my bigger jump to clinical. From there, when I started married and started having kids, I kind of went down to a more of a clinical but a consulting position, and then ended up consulting in a long-term acute care facility that was inside of our hospital. So guess what? I did what you do. It sounds like I did wound care, nutrition for the patients that were there long-term in this little facility, and I loved it. I worked directly with a wound care nurse,
Mm-hmm.
and we kind of developed a little bit of protocol there. Um, then from that, I left Louisiana because of the hurricane. My job actually was wiped out. So that was a crazy sort of a new start for me. I moved here and I started at Children's. The managing position, which was the first time I had ever been told I wasn't qualified, required a master's. So they interviewed me, which was nice. That opened the door for the diabetes education position.
Mm-hmm.
And I like that a whole lot better than managing. So I stepped into that role and became a diabetes educator. And I was there for 5 years and really realized every patient or every client I've ever wanted to work hard with was obese or overweight. So at Children's, I ended up with all the foreign patients. So I learned the challenges of working with interpreters, and you have
Mm-hmm.
to really slow down and repeat a lot. Um, and that's when I discovered I really love nutrition and obesity. And so that brought me back to here, the clinic setting with bariatric surgery. So a lot of experience. And I think, what's most helpful to me, and when I was in Brunswick, Georgia at Southeast, what's the name? It changed names. Southeast Georgia Regional Medical Center, I think is the new name. Um, I taught some of the medical students nutrition. I loved that. But what I realized is a lot of the newbies would stay about a year and then they'd go off and do sales. And what I said to every one of them after 1 year of clinical experience, I really feel like you should get the clinical down and then go into sales, get your feet wet in a lot of numerous, areas, a lot of variety, so that you can end up having your own business if that's what you want, or you can end up working with patients of all, clinical diagnosis, comorbidities, and then you're going to feel more of a master,
Mhm.
than a struggle. So that was a lot of experience. I can't even say the year I graduated, y'all will flip out to know how old I am. A lot of years, I'll just say. 88, I graduated. My little diploma I found after the hurricane that's up here on the wall was my maiden. So, yeah, a lot of years. So, was that enough of a background, do you feel?
Yes,
To
that's great.
introduce some questions? So, I work in a surgical group. There's about 5 or 6 surgeons, and I feel like surgeons oftentimes misunderstand what we do. You know what I mean?
Mhm.
It's not as easy as cut and dry as a surgery is, and a post-op surgery. Um, so, shall I open it up to questions, or I'd love to ask you guys, has anyone had a really challenging position that they had to overcome, a face-to-face run-in, let's say, that you were challenged by someone? Maybe not even a physician, maybe someone else. No,
Oh,
it's not like that anymore then.
I've definitely experienced some, but if anything, we would really like to know what is your day-to-day look like as a um, bariatric di surgery dietitian?
Okay, that's a great one. So, the typical schedule in the office for the surgeons and myself and the PAs, physician assistant, is they start at usually 9 and see patients till 4:30, maybe 4. I opened up the door to, I'll be happy to see an 8 o'clock patient if anyone wants to come early, thinking, oh, no one's going to want to come at 8 o'clock. Well, so my day starts at 8 with a patient, and sometimes I have a 3:30 to 4, but a lot of times it finishes at 3 to 4. Usually it finishes at 4. So again, I don't create my schedule, but I did create all of my educational PowerPoints and my handouts. So I got to set kind of the protocol. The first patient, the new patient, requires an hour visit, 60 minutes of education, and the follow-ups are all 30 minutes. And I also was allowed when COVID happened to do some telemed from home, and actually became telemed from the office, just because it was at first new to the clinic. So I generally see patients all day long, 5 days a week. But the nice thing is I get to develop my protocol and my teaching based on what the surgeons, want. The
Mhm.
surgeons will say, all right, we're going to allow our protein drinks to have, X amount of carbohydrates and protein. And so the nice thing is that I have developed a couple of basic educational pieces, but then I was able to elaborate depending on what the insurance company needs. So I got to create my own. I have a holistic PowerPoint on hormones. I have a couple of PowerPoints on goals, how to set new goals and weight loss goals, and how to kind of extinguish the negative goals. So it's stuff really off the beaten path of nutrition, but sort of interrelated, you know? So I generally see about 6 to 10, maybe, if they're 30-minute visits. 1, 2, 3, 4, 5, 6, 7, 8, 9. So today I have 9 patients. Um, it's always with an outpatient setting or in a clinic setting. You're at the liberty of the timeliness of the patient, the traffic flow in downtown Atlanta and Buckhead.
Mhm.
So it's never ever always cut and dry.
Mhm.
Fridays are the worst. Tomorrow will be probably I'll be here till 5 or 5:30 just because, the late patients. But there's a lot of freedom in that I can develop what I like to teach. And teaching becomes challenging because you have all walks of life. You know, you have young patients, you have old patients, you have motivated patients, you have not so motivated. Um, I will say I used more psychology of eating in this position, than ever before, because we all have a choice. So, um, and I've learned over the years to listen more than talk. That's super big, right?
Yes.
So What is a typical clinic day for you as far as patient load?
Oh, for me,
Just kidding. Yeah.
it
Is it
depends on
10?
it's
Or the day?
it depends because I know we have like what 5 to 6 clinicians per day, and then per clinician they're seeing about like 5, 7 like clinic wise, and then I think our doors open at 7:30. But then we also have the HBO patients, and that will we open up earlier, so 7 for them to come in, and the day just goes like that. And then sometimes we'll
Yeah.
get we try to like finish up right before lunch, but then we have that one patient that comes in at 11:45
Right.
and then kind of goes
Right.
over to lunch. Um, so yeah, it's kind of similar to what I feel like your clinic is like with
Yeah.
your patient case, and so is our clinic in
Yeah.
terms of like
There are
volume and
some. Yeah, there are some days when I do a whole lot more, and it's so challenging when there's a telemed for 30 minutes, but I have 6 of them before lunch. And if the patient doesn't know how to log on, then you're dealing with a 10-minute, and you're like, I have 10 minutes to teach. It's impossible to teach and ask for feedback. Do they understand it? And then set goals. I'm really big on having them set goals and to
hmm
try, you know, make it measurable and realistic. So it's nearly impossible if they're late, to
right.
do a good clinic visit in 30 minutes on a telemed. But so yeah, it's good to know that you have the same challenges. But I think, the wonderful world I live in is that I get to create my own education, so I can dumb it down or make it harder for patients that are really, technically very skilled, or they're in the healthcare field themselves.
hmm
So it's nice. It's nice for that reason. Um, what
What are
else?
some challenges you face on either day to day or like just overall in your setting?
I have to say it's probably the education level, or actually the self-efficiency maybe of a patient, the motivation level of a patient.
hmm
Um, we get a lot of people that not only, being morbidly obese, some of our patients, I think that the heaviest we've ever had is probably 700, 690 pounds. So think
hmm
of, where is their motivation? How many times have they had to force themselves to pick themselves up, leave their house, and go into a clinic setting? There's so many obstacles for them, physical obstacles, but more than that, mental obstacles. So it becomes, again, 30% of the visit is picking them up, you know, reinforcing to them that I'm so glad you made it in today. You could have
hmm
very well easily called in and canceled your scheduled appointment. Um, and I'm glad you're here. Let's pick up from where we left off. So, um, and if you're the kind of person that gets easily flustered when things aren't, how many dietitians do you know are not OCD? Are not, this is the way it's got to be. I am. You have to be. You somewhat
hmm
have to be in a strict clinical profession. So when things get tossed out that window, and your patient is 30 minutes late, and you have to see them because they say to you, Justine, I need you to see me. You have to
hmm
see. So you have 5 minutes for the 30-minute visit, and you say, sure, I'll see you. So it's not so easy when someone is very cut and dry and has to
hmm
be 30-minute visit. You just adapt. I feel like you need to be versatile, and you need to let go of some of those. I need to let go of some of those stronghold that I have to have this. It has to
Right.
be 30. I think working in diabetes ed, there's a team of a nurse and a dietitian that taught the 2 inpatient classes. And the first class was just generalized blood sugar monitoring and teaching insulin injection, and they practiced that while they were there, and carb counting. So the
Oh.
nurse would do the insulin and I would do the carb counting. And then the second visit, they practiced what they learned, and we did kind of menus and recipes. So working hand in hand and side by side with a nurse was totally eye-opening. You know, they adjust to, like Hurricane Katrina, for example, all the people that were caught without a home and had to climb on their roof to get away from the water and reuse their insulin syringes. And here I'm teaching, you only can use a syringe, you know, the X amount of times. Well,
Right.
this is all they had. They used it till they didn't have any more to
Mm-hmm.
use. So it's kind of a huge difference in what we kind of demand as a profession, and then I'm going to work with what I have.
Mm-hmm.
These are all the skills I have. These are all the materials I have. So I think that's another challenge kind of to overcome, learning to work with what you have.
Just trying to be flexible with, whatever comes at you.
Yeah, but also a little bit demanding if we don't have the tools to do our job.
Mm-hmm.
You can't really do it as well as you can do it. So making sure you have that, but making do with what you have as well. So
Gotcha. Um, if anyone else would like to ask a question, you're free to do so. If not, I also have a lot of questions myself. I'm really happy that you were here because I loved hearing your background and um,
yeah.
how you where you are today. Anyone else have a question? Can I ask?
Are there any males in the group today? Are they all females?
We have a couple males.
Yeah, I actually got to work side by side with a few. It's kind of different. It's a different world.
Hey, Justina, I think there's a question in the chat box.
Oh, okay, I see it.
Yeah.
Joshua asks, was there a specific time, educator, or event that solidified your decision to pursue a career in nutrition?
Well, that's a great question. My first nutrition class was at night, 6 o'clock till 9, I think it was. And at the time, I thought I always knew I wanted to be a dietitian. I think growing up in a family that was Italian and more to eat and more to love, size wise, you know, bigger size family. I've always been interested in it, and this first nutrition class that was at night, the teacher used to always say, "So is everyone eating dinner? You know, I want to make sure you go to the vending machine and get cheese and crackers. They actually have milk now in our vending machine. Nowadays, there's protein bars, and you know,
Yeah.
this was back, I told you, in the 80s, right?
Hmm.
When I was in college. So I thought that lady is so really cool. She was pregnant, I think, too. She's always interested in what we're eating and making sure we have enough nutrients for our brain to work, and that's kind of where I was. I also grew up with a twin brother, so I'm very competitive. I'm very physically, mentally, everything is competition. So I always believed early on that nutrition kind of fuels the body. And as I joined ADA, one of the subgroups I did was sports nutrition. You know, as you can join those little individual groups. So I think I think growing up in my family, being competitive sports wise, and you know, my first job, I said, yeah, this is it. This is what I like to do. I guess maybe my first job in clinical, because the management side, not my favorite. You know, I like it. I like to be Charles in charge, but I like the clinical. Did that answer your question direct enough?
Joshua also said he's a twin, and he also agrees about, I guess, being competitive.
Yes, that's awesome. Yeah, that's cool.
He said yes, thank you.
Good.
All
Awesome.
right.
I have a
Uh,
question. Can you hear me?
we
I
can hear.
can.
Okay. Do you happen to have like shadowing opportunities where like people come in and like see you work and see like what your day to day is like?
Well, I actually had one request. It was referred to me from my friend who's recently retired. She used to be over the kitchen, the managing dietitian. And the gal came for a day, and it was kind of a really not challenging day for me. They were like all visit twos, and it was the same thing. Everyone had the same little test that we review and the shrink the liver diet. And at the end, I said, well, so what do you think? She goes, well, not my cup of tea. I was like, it wasn't a great day. So since then, no, I haven't. And I'm sure I just have to pass it by the practice manager, but I'm sure it would be allowed as long as the patients agree, that they'd like to allow you to sit in. It would be fine if there was an interest. I think we'd have to, of course, go through HR and have you sign something, but that's all.
Right.
I
Okay,
think
cool. Thank you.
I believe with Piedmont, it's just a couple of it's on their policy stat because I've done it a couple times for shadowing where um
Ah,
yeah, you can just print out the papers and you just sign. I think
okay,
whoever is the person that's shadowing and then the clinician or provider or physician that um is wanting to be shadowed, they also sign as well.
gotcha.
Yes, so
And it gets turned into the HR department.
no, I believe you just keep it or the
You just
manager
keep it on
of the,
us.
yeah,
Give it
that's
to the
it.
manager. Okay, perfect. Perfect. Yeah, that's great. I enjoy it. I think I forgot to tell you the second wisdom because this has been a crazy busy day. My second pearl, I guess you would say, is always, you guys are great at it with all this new Facebook and LinkedIn, right?
Mhm.
And Twitter accounts. Always keep your professional ties with everyone and anyone, and always go to as many meetings as you can. Now everything's virtual because of COVID, which, my last diabetes ed, I got a bunch of hours, but it was all virtual. So I missed the opportunity of meeting people and marketing yourself and so it's really important what we know, but it's also more important who we know and keep those contacts. And I'm sure you guys, you know, do that often. You should continue to do that often,
I
right?
know all the guest speakers we've had so far. I know in our senior class, all the guest speakers we've had so far, they very much emphasized on, having your professional ties kept with whoever you work for or after you
Yeah.
leave, because you just never know. You never want to burn a bridge. So,
Absolutely, absolutely. My first boss ever in management ended up after Hurricane Katrina being well, not that after before the hurricane, ended up being my third boss. And he said, this is the easiest interview I'll ever have. How much do you need? How much do you want to make? And I was like, oh, really? You're throwing that out to me? So, it was beautiful. Just like you said, Justina, just never burn your bridges. Always keep that. And once someone knows your job ethics and what you're capable of, there's really no need to sit, except for you to understand what the job is. What's my day-to-day duties and my responsibility. So, great point.
yes. I guess we can wrap up from here. Does anyone else have a last question you want to ask? Well, thank you so much, Miss Andrew. Hopefully
Welcome.
we can we can get this video out and have our other members watch too. Just I know because our schedules kind of all conflict with
All
classes, so
right.
hopefully they're able to watch. And if you're okay, would you be fine if I put your email down if they want to ever like shadow or reach out to you?
Yeah, no, absolutely. I was just gonna to mention that both my email and my office phone number. So it's just my name, Karen.Andry, Andry, at Piedmont.org. And then my office phone is 404
Uh-huh.
609 5057.
0957 5057.
Yes.
Okay, 5057 Got it.
Yeah, perfect.
All right. Well, that concludes our meeting today. Thank you guys so much. Um,
Thank you. Thank you for inviting me and anyone I would offer your, questions, comments, concerns. It's kind of nice to keep in touch.
all right.
Enjoy
Thank you.
and good luck in school. You're welcome.
Thank you. Bye, everyone.
Bye.
Bye.